Hello, this is Carolyn Harshman. I'm the second vice president of the International Association of Emergency Managers. We are delighted to welcome all of our panelists and participants to today's IAEM-USA's webinar hosted by our Disaster Cost Recovery and Finance Caucus. IAEM maintains more than 20 committees, caucuses, and ad hocs in a variety of subject areas. The Disaster Cost Recovery Finance Caucus routinely meets on a bi-monthly basis to review federal regulations and audits relating to disaster cost recovery. All of the IAEM-USA webinars are recorded and posted on IAEM's website landing page. The posting for the caucus's webinar also includes a frequently asked question document that reflects questions and answers from the similar COVID-19 webinars conducted earlier in April. Your registration information will be used to issue a certificate of attendance. Today's presentation format will allow for statements from our panelists and questions submitted through the GoToMeeting chat function. Welcome and enjoy.
And good morning, everyone. This is Mike Martinet. I'm the chair of the IAEM Disaster Cost Recovery and Finance Caucus. And we're delighted to have you here. We've got over 130 people on the call right now. And first, I want to introduce our panelists. We have returning with us today, Margaret Larson from AG Witt. Margaret formerly worked with Ernst & Young, formerly with FEMA, and formerly in the nonprofit sector. Margaret's got years, and I won't use decades, but years of experience in disaster cost recovery. We also have Wendy Huff Ellard, who is with Baker Donelson, law firm in the East Coast and Southeast. Wendy has over a dozen years of experience on the side of local jurisdictions who have disagreements with FEMA, and they have a substantial practice in helping agencies do battle with FEMA over cost recovery. We also have Branch Strickland with us. Branch is with Ernst & Young, and Branch has over 10 years of experience working with the city of New York, including 6 years as executive director of grants and financial planning in the city's emergency management office. He managed public assistance claims in Hurricanes Irene and Sandy and the whole alphabet soup of Homeland Security grants through FEMA. And so that is our panelist for this morning. And we also have posted on the website a slightly over 100-page handout that is available to you. It is the latest compilation of files, policy statements, and useful documents for processing public assistance claims. And in particular, I would note there are 3 different documents relative to procurement. Procurement is the greatest single exposure that public agencies have when using FEMA funds, and actually the rules apply to all federal grant funds, not just FEMA, but all federal grants. And with that, what I'd like to do is start with a few questions among the panelists, and then we'll go into the Q&A, because we all learn from you folks some of the issues that you're dealing with. The first thing I want to direct to the panelists is a question of, have you seen a good chart of funding streams for the CARES Act? Not only a good chart that shows the various federal agencies, but also any kind of prioritization, if you will. So for instance, transit agencies may be able to get 100% funding through the Federal Transit Authority, But if they applied for FEMA funding, they would only get 75%. So clearly, for those things that are FTA eligible, it's better to go there because you're going to get 100% as opposed to 75% funding. So we'll start with you, Margaret. Have you seen anything or do you know of any resources? I looked yesterday, I couldn't find anything good. Everything was broken up by segment. So CARES for hospitals, CARES for colleges and universities, CARES for local government. I found nothing that was really comprehensive. Margaret?
Mike, we are finding the need to develop this for our clients because you're right, it is bifurcated by the particular eligible subrecipient or recipient. And so we know too that, so we are putting one together. I'm sure that Wendy and Branch are also doing the same because it's becoming, very clear that some of the eligible expenses covered by CARES, covered by FDA. Another example is the Bureau of Justice Assistance for law enforcement. Theirs is another 100% eligible reimbursement for PPE for law enforcement. And so just keeping track of what those are and making sure that you can see the delta between what's reimbursed there and what FEMA might reimburse for, if they even would, once those funds are expended. So we're putting something together. I'll open up to the others because it's something in development for us, but I looked on a number of websites as well from the likely sources that would have put a cross-cutting document together, not just of CARES Act, but for all the other federal funds.
Branch, how about you?
Yeah, and I would just echo what Margaret was saying, is that there really doesn't seem to be a comprehensive listing of all the different CARES Act programs. I think we last counted and there were over 50 in the last CARES Act of new programs that were supporting state and local governments. And I think this is further complicated that policies are changing, guidance is continuing to be released, and then there's this whole discussion on a new CARES Act specifically targeted to state and local governments. And all of this does change as you have local emergency managers and state emergency managers trying to prioritize which costs are going to which funding source. I think keeping abreast of what the current policies are, what the current programs are, is going to be critical, especially as we get more targeted funds, because I think, as we all know, the FEMA dollars are the dollars of last resort, and you don't want to get into any duplication of benefit issues where FEMA might say this other funding source could have paid for it, so we're not going to, and run into issues there. And then I think there is a whole strategy of leveraging all of this funding to make sure that everyone gets not only their fair share, but really the maximum amount, of all the different funding sources that are out there.
Thanks, Branch. Wendy, anything?
Yeah, much the same. We also have not been able to find a good workable summary of all the funding sources out anywhere. So we are working to develop something including all of the varying reporting requirements, because I think that's going to be an issue, especially for some entities that are getting funding from multiple different programs. A lot of them have quarterly reporting requirements, including FEMA's. So you are going to need to be very cognizant of all of those issues. And also, as far as coordinating the different funding sources, it's very important to be intentional on the front end about how you account for your funding and what cost you submit to some of the programs for the ones that require cost documentation, because I think it's going to be hard to back that out later if you realize that you have duplicated funding. I think you're going to face instead a reduction, especially in FEMA's case. So I would recommend looking on the front end at the available uses for each funding source and being very intentional about how you structure your funding so that you can get the highest and best use of all of it and hopefully maintain it all. because I agree with Branch too. We're hearing word that there will now be another funding package aimed primarily at state and local governments. So, the more differing pots of funds out there, the harder it's going to be to coordinate everything. So while it's great that there are multiple resources, you need to be careful in how you allocate and account for them.
Hey, Mike, it's Margaret. To jump in on what Branch and Wendy have both said, we are also finding it's complicating the fundraising arm, philanthropy offices, for example, colleges and universities, and the message that they're trying to get out to their donors, because it's very difficult to fundraise for something general that would be non-FEMA eligible. And it's easy to fundraise, as example, to say we need PPE and disinfectant and so forth for our dorms, for our students. And so what all these funding sources are doing, in addition to providing money to help with the response and recovery, is complicating strategically fundraising around other sources and money that can help with a community, coming back to an operational stance. And that also includes if there's a community foundation for a city, for a county, or foundations that may be trying to provide funding to the local governments. It's complicating that kind of strategic financial recovery as well.
Okay, and you've given me a very nice segue into my next topic, is that of PPE documentation. Masks, gloves, face shields, Tyvek bunny suits, whatever PPE is involved for your employees. Typically, FEMA requires detailed documentation, where this stuff went, who used it, when did they use it, and they require sign-up sheets. And my question to our three panelists is, do you think there's going to be any backing off of this required detail, that every time you get a $5, $10 mask, you got to sign for it, or a pair of blue gloves? I mean, at some point, the cost of tracking this stuff may be more money than you're going to get from any government agency. And Branch, let's start with you this round.
Sure, and I think if there's one thing I think we've all learned from FEMA is, they do have a lot of rules and regulations on documentation requirements. And you've seen it, we mentioned procurement requirements as well, that these still apply despite, what the conditions are on the ground. I know FEMA has relaxed, particularly around procurement, some of those rules and regulations on what they expect you to follow. But until there's official notification from FEMA that you can point to, I would certainly advise that you do as much as you can to document during time of, and I was admin finance section chief during Hurricane Sandy for the city of New York, and we were struggling with the same sort of issues, that you want to follow the rules, but at the same time, there's life safety issues that are going on, and those are two kind of conflicting desires, and most of the time, life safety will hopefully win out. But at the same time, FEMA does expect a certain level of documentation, and I would just really advise. I know it's challenging, particularly with an activation that is going on for 2 months, and for all we know, could go on for the next several months. To really try to document this as much as you can. Time of doing it after all of this is going to be challenging, particularly that there wasn't a short incident and then a long recovery period. We are still in response. We'll eventually get to recovery, but trying to do documentation after EOCs are closed up is going to be a struggle. So just would advise really pulling together that documentation, particularly around PPE, as best you can during this time.
Okay, Wendy, any thoughts?
Yeah, I agree with that. I do hope that we see a little bit more flexibility from FEMA as far as detailed usage rates. But if you look at the project application, and the standing FEMA material summary, there is a space on there for at least date used. And so I think you should continue documenting just to the greatest extent you possibly can, detailed usage with the identity of the the person. But if you can't get that detailed, try to do it by day, try to do it by branch, try to do it by department. Just get as much information as you possibly can. One issue that we are seeing come up is also some difficulty in proving that the expense is directly related to the event. And the issue that we're seeing is whether you would have purchased it anyway, gloves for your medical personnel, PPE for police and fire, just an argument from FEMA as far as whether those items were, were really used to combat the COVID-19 response, or whether they would have been purchased by you anyway. So I would also encourage you to look back at your cost for, last year, year before, and pull information on that if that question comes up, just to show the escalation of cost, the increase in amount, as a way to show that the costs you're claiming really are as a result of this event. So that's another just point that we're seeing already early on.
That's a great point, that you would have maybe bought some of this stuff anyway. So, yeah. Margaret, your thoughts, please.
Well, I was going to add to the cost reasonableness point that Wendy was making too, because obviously last year these were much less expensive, and so the cost that you incur at this point in time, we know that the logistics and supply chain demands have been convoluted and frustrating for people, and it's taking a lot more time to find stuff. So and if you find it, that the costs are, you're told it's available and then maybe it's not available for a variety of other reasons, but just documenting where you came up with that the expense that you're incurring now, and the cost of what you pulled out of your prior existing stock. So that's something that I would definitely emphasize.
Yes, and if you pull it out of stock, you need to document that you've taken it out of stock and where it went and what it was used for. Okay, thank you, panelists. I'd like to talk, and Margaret and I had a previous conversation offline about this. We both had people we're working with approach us on the question of donations management, and that was already alluded to in previous comments. And donations management is just it's a Wild West situation, because you've got small donations, and we talked about the Kansas farmer that sent one mask to Governor Cuomo. I think that's probably the smallest donation. But then you've got what I call legacy donations, big donations, hundreds of thousands of dollars. And then you've got the intermediate ones, and one agency I'm working with, arguably a little more affluent community, they've got some business people who wanted to donate money to a fund to allow that fund to be distributed to small businesses that are really struggling. And so they wanted to have people put in an application and then have a lottery. And the thought was that donated money would also be a tax write-off for those business people. But in looking at the IRS regulations, it says for a government purpose. And I don't know that giving it to a private business is a government purpose. I could make an argument for it, but I'd hate to be arguing that against the IRS. So since this is a bit of a legal question, Wendy, why don't we go to you first?
Yeah, I'm not sure I understand your question on whether a business purpose would matter as far as FEMA's program is concerned. I will say that this is another area where it really matters. An ounce of prevention is worth a pound of cure, so to speak. I think to the extent you can, you need to set up those formal donations or help programs for general purposes. And for any donations, the smaller types of donated materials kind of things, anything that is for a purpose that is eligible for FEMA, just know that you can count those things towards your non-FEMA cost share, which right now is 25%. I've seen a lot of reports that may or may not go up, for some states, not others. But right now, that's what we've got to deal with. So 25%, you can count donations that are given for a specifically eligible purpose towards that. But best case scenario, best use of those funds is to try to mark them as an ineligible purpose, operating cost, or for a general purpose, just for general recovery efforts, because FEMA will not consider those items as a duplication of benefits.
Margaret, how about you?
So I think too, when you and I were talking about the those donations that were coming in basically through either an individual giver or a foundation, that part of it too is how do they structure that giving. If it's not in an existing foundation, there's a lot to be set up from a tax purpose, which I'm not an attorney or a tax lawyer on to be able to advise on that. But generally speaking, it is, like Wendy was saying, trying to identify those non-eligible FEMA costs or things that FEMA is not going to be reimbursing for, and trying to maybe direct some money towards those activities as well. Because if you're going to get 75%, for example, from FEMA for the purchase of PPE, there's another activity that maybe is non-FEMA eligible that they, just understanding what's eligible for FEMA may help them make their decisions. And that's part of what we're going through. It's back to that initial discussion, all the various funding sources out there, and where's the greatest unmet need that's not going to be compensated by government.
Okay, well, Margaret's recovering her audio. Branch, your thoughts, please.
Yeah, and donated resources is near and dear to my heart, particularly post Hurricane Sandy in New York. I think that was an area that we unfortunately did not claim as much donated resources, separate from the donated cash discussion. But the supplies that either organizations, companies, individuals dropped off, the volunteer groups, the use of equipment. We admittedly did not do a great job at tracking those donated resources where it could have offset the local cost share. And I think that there are challenges in an EOC for donated resources. They often come straight into the logistics center, or volunteers just sort of show up in the field. So there is a challenge at getting documentation for those. And donated resources, I think, by their nature, exist outside of the process that generates paperwork that you would normally capture to submit to FEMA. There's not an invoice, there's not a purchase order. And so you really do have to create that when these are received, whether it's sending a thank you letter to the donor, expressing your thanks and listing what they donated, or just creating an internal tracking database so that when you do go and submit those donated resources to FEMA, which is the last PW to be obligated, so at the very end of the process, you have all that documentation with you. It's easy to lose all of that. I think certainly would advise everyone that does have that donated resources that are in your localities or in your states to definitely take a look at how you're capturing that information, because it's very easy to delete an email for someone to retire or move on to another job when you're trying to compile that information months or years later. And so anything you can do to track that now, I think will pay dividends. And actually, in this case, will save you some money when you do use those to offset your local cost share.
Thank you, Branch. I'd like to move on to the next question. This is one that a number of people I've talked with have expressed some concern, and that is getting documents signed. So you got people working at home, virtually in the EOC or a virtual call center or lots of different COVID-related jobs, but they're at home. So how do they get their ICS 214s or any of the forms they may be using to track their time? How do you get those signed? The options are an electronic signature like DocuSign, but my understanding is that can cost you $5 per signature, which get real expensive. Or are we going to be required for wet signatures in blue ink? For the panelists, is anybody been dealing with this and talking about this important getting key documents signed by people, especially when they're working remotely? Margaret?
Mike, I dropped somehow, but
Yeah.
So the issue of how to get things signed and forms, we have set, so what we've been trying to work with clients on is establishing a process that's their internal policy on signatures and remote signatures, so that we at least have something to document the rationale for why they're doing it remotely, electronic signature or otherwise in the meantime. Trying also to schedule some time with when we do, which is limited, have a PDMG, trying to discuss with them some of how they're recommending that we handle that. So we're still trying to find an answer, but in the meantime, a specific answer that FEMA will agree to in the meantime, because like you mentioned, it's going to be very expensive to have to use a DocuSign, $5 or whatever the price may be, cost associated with every single signature. So if we can come up with a standard client, subrecipient, recipient policy on that, we're helping them develop that and writing a memo if they didn't have such a thing already, writing a memo, contemporaneous memo explaining why.
Very good. Branch?
Yep, and I would just sort of echo what Margaret was saying, is that, I think particularly with this unique, challenging environment, obviously you'd want to see what your local and state requirements are for signatures, but I think we all understand that this is a challenging and unique and really unprecedented environment. So the more that you can document, the steps that you took to try to follow your procedures, whether to be an original signature, we've had to do, where that was just unable to be obtained, done, an email saying I certify XYZ dated, and we printed that out and included that in the backup documentation. So I think there are ways to document outside of a wet signature, but I think it does obviously depend on what form it is that you're using and what your local, state, or regulations are. I know even with notaries, New York State has relaxed the in-person requirement for notarization. There are some specific steps that you still need to take to get a remote notary, but even that is now possible, and I think that does depend by state on what flexibility there is there. But I think the longer this goes on, the more we'll see some of that flexibility and creativity come through. But it just goes back to, I think, FEMA as a whole. The more you can document and show that what you've done and your attempts to do it correctly, understanding that we're in a unique and challenging environment and we're not all working together, that will help when they are reviewing that documentation, that they can see you don't have a wet signature, but here's an email from an individual attesting that they approve this payment request or this purchase of supplies.
Very good. And Wendy?
I'm not sure I have much to add to that. States are definitely easing some of the notary requirements. I know ours has provisions allowing virtual notaries and things, state by state deal, and definitely look at what your policies say. And if your policy allows for any kind of adjustment during emergency circumstances, I would follow the protocol in your individual policy. I would actually follow that for any type of deviation that you're seeing from your written policy. We've seen that for signatures. We've seen it for procurement. We've seen it for meetings. A lot of local entities require in-person meetings, a certain amount of board members at the table for a quorum to vote on things and things like that. And so we are seeing some of those things waived by state law, some by local law, and some you can waive yourself, just depending on what kind of entity you are. So it's another thing to know what you're dealing with and look at it on the front end, for sure.
Okay, thanks. One last topic of discussion, if anybody has information on it. I was on with a California client and was referring to the President's Declaration, National Declaration of March 13th, and somebody referred me to another document that specified that in California, costs were eligible from January 20th because they were on it so early. That's when the governor proclaimed in California. Any thoughts on that, Margaret? About these varying dates of the retroactivity of when funds became eligible for federal funding under CARES?
So we have been working to track costs to January 20th for anybody I'm working with in California. Our declaration is specifically dated the 20th. So it was declared on March 3rd, and it is a retroactive date for us. So ours is specifically, it does include it. But you're right, for all the declarations that have come out there, if they have different dates, it has to be tracked according to, and eligible expenses will be at that date, the initial date that FEMA sets.
And so that's going to vary from state to state, possibly.
That is possible, yes.
Wendy? What do you?
Yeah, of course, look at your individual state's declaration, but all of the ones that I have reviewed are backdated with an incident period beginning January 20th. So that may be across the board.
Okay.
And to pull that, you can go online to FEMA.gov and pull your state-specific declaration and look at the incident period. So it's pretty easy to confirm.
Good idea. And Branch, how about you?
Yep, same thing. I believe all of them have been backdated to January 20th for all the states and territories. But I would definitely go by your individual state. They're all on FEMA's website. And I know even the very last one before we hit all 50 states and all the territories was America Samoa. Theirs was granted on April 17th, I believe, and that one is also backdated to January 20th.
Okay, all right, thank you. Let's take a couple of questions here. May CARES Act funds be used to match FEMA PA dollars? Anybody can jump in on this if you know the answer.
Mike,
Yes.
Oh, go ahead, Wendy. Well, I was going to say it's unlike CDBG DR, where that can be used, commingling of the federal resources is not allowed. And I haven't seen any guidance indicating otherwise for CARES Act. Wendy, have you seen something that differs?
I haven't. However, I will say that the Treasury Coronavirus Relief Fund, the $150 billion that was sent out to states and some locals based on population, I have specifically asked whether those funds can be used for the non-FEMA share, and I've been told that FEMA and Treasury have discussed it and that the issue is currently being contemplated by Treasury. So I would watch for that. But yes, generally you cannot mix federal funds unless the statute specifically allows for it. And so far, the only instance where that's allowed is CDBG funding.
Okay.
Mm-hmm.
Let's see here. This is about homeless shelters. If homeless shelters need to relocate a significant number of guests, this may involve housing, meals, laundry, transportation services. Which funding source should we be going to first? And what administrative processes should be in place prior to initiation? So where should we go first for the money, and what administrative process should be in place before we even start that? I'll throw that out to anybody who's brave enough to take it on.
Yeah, I don't mind going first. So as a general standpoint, the FEMA dollars, are funding of last resort. So if there is another eligible funding source that could pay for the sheltering of homeless individuals, you would obviously want to look for that, whether even if it's another state funding source or local funding source. With that being said, FEMA has released guidance on non-congregate sheltering. So, typically the shelter system is a congregate where everyone's in the same room, whether it's at a school gymnasium or a stadium. That clearly doesn't work in a pandemic situation where you do want to isolate individuals. So FEMA did recognize that, and they did issue guidance on these steps to request, and you have to request this, but steps to request FEMA approval for non-congregate sheltering. You can request the individuals that you plan to cover for that. And so I have seen, for instance, in New York, they did request vulnerable populations like the homeless that they're making the case, left in your typical homeless shelters, they're at greater risk and would actually, would incur not only greater cost if they were to get sick, but a greater health risk in the normal shelters. So that FEMA did approve that request to shelter homeless individuals. I've seen similar approvals going across the country for that. And I think the thing to note for this group as well, that request, at least in New York, was granted retroactively. So the city had, and I don't really recommend this for a lot of local governments, but they had incurred costs already housing people in hotels in that non-congregate sheltering, and they were able to convince FEMA to cover it at a backdated date to get those costs covered.
Okay, thanks, Branch. The question here is, if a city donates money to a school board or nonprofit for providing food for families, is the monetary donation a FEMA eligible cost? Margaret, you want to tackle that first?
Okay, if the city donates money to a school board or another nonprofit?
Yes.
So the city can track that as a donated resource.
All right, so it would be eligible for their cost share match.
That is my understanding, yes. And I've seen more where they're requesting assistance from the nonprofits to work with them on providing food and like school lunch program and others, they're requesting assistance from nonprofits too. And so that's a little bit different. So, but the way that you described it, I would say it's something that they can attribute to their non-federal cost share.
Wendy,
And I think,
go ahead, Branch.
and I think if I understand, if a city were to, I think, perhaps the word donate is slightly confusing in this situation, but if a city were to say give money or to pay a nonprofit to do COVID-19 pandemic response activities, that in essence, that nonprofit is operating as a contractor. Say you were going to pay, some nonprofit to do meals or some type of eligible activity. I believe that should be eligible as a Category B expense. But I think some of these really in the weeds questions like this, like if it's a gray area, you should absolutely document it, rather than just question it, because it may be eligible, or FEMA may, as we've seen with some of the additional guidance that FEMA has been releasing, they may release future guidance where costs like this that are sort of in the gray area do become eligible in the future, and you will want to have everything documented if that's the case.
Yeah, and I think the key word here is donates. If they donate the money, that's one thing, and they could use it as a cost share. But if they were to contract, as you said, with them, then it would be 75% reimbursable. So you got to have a little strategy session here.
Right.
What's the smart way to do this? We know what the moral right way is. The moral thing is to help, but you can help and benefit in some cases if you do it properly. Wendy, any thoughts on that?
Yeah, no, I agree with Branch. Exactly. That's what I was going to say. Suggest that they instead contract with, and in that situation, as long as the public entity or applicant is found legally responsible for the work and that the work is eligible, it could be a private nonprofit or a for-profit for that matter, as long as the costs are reasonable. I think they would be viewed as a vendor as long as the work is eligible, the cost reasonable, you go through all the other requirements. I do think that FEMA would pay those costs. There is a specific fact sheet on food. I'm trying to remember exactly where I saw that. But that would be something to consult for this event too. I think FEMA has realized that here there's a lot of very unusual circumstances. Children are out of school. A lot of those children rely on the educational system to feed them. A lot of families are out of work. So FEMA has issued additional guidance on that.
Yeah, in our handout that's available on the website, there is the FEMA document on providing food.
Great.
Okay. Okay. There's another question. We have combined resources in Florida and have a large quantity of some PPE products at extremely reasonable prices. Are there any resources you are aware of that we can use to notify municipalities or companies what we have, since our clients have not needed what they originally planned for? Okay, so this is an interesting question. So they've got a lot of some kinds of PPE at competitive prices. Is there any resource we can use to notify municipalities or companies that they have excess? I guess that's the gist of the question.
I would recommend contacting FDM.
Who's that, Wendy?
FDM, the state agency in Florida.
Yes.
Mm-hmm.
Yes.
Wendy, I absolutely agree because they will have a sense of where they've had trouble procuring
Mhm.
some of these items. And Mike, I was going to make a joke that maybe we could ask the farmer to help us.
Absolutely. My good colleague, Betsy Thomas, down there in Galveston, Texas, says, I've seen some guidance on non-congregate sheltering, and it has to be ordered by your local health officials. So that's Betsy's comment. Let's see here. Okay, if we are doing non-congregate sheltering, will FEMA cover the whole cost or only the cost for the rooms used? To get an agreement with a hotel, we need to get an entire block, and we don't always fill the rooms. Okay. Anybody?
I think there are a couple of things that are going to come into play there, and we're actually seeing the same type questions come up for surge capacity. I think first you're going to need to explain to FEMA why it was reasonable and necessary to procure the whole block. And I think that can include predictions, reasonable predictions, letters from public health officials, data from the state on expected surge. You have to show that you thought you were going to need that capacity and you were reasonable in that thinking. And then two, even if you cannot justify the full space, if it was more cost effective to get a whole floor than to get a half floor in some other facility, then I think information to show that would be helpful. Pulling quotes from different areas just to show that a per room basis, because you also need to comply with the social distancing requirements, the CDC requirements for these shelters. Anything to show that this is the only solution you could find or the most cost-effective solution you could find is going to support that request. And then I would, it's a little bit different from the exact question, but just for anybody else that has similar issues on surge capacity, FEMA did issue a policy over the weekend for medical care specifically, and it has a pretty detailed section on surge capacity, including some additional requirements for documenting the need. And I would recommend that you look over that for sheltering and definitely for surge.
Okay, thanks.
And Mike, I've also seen, Wendy, thank you, because I had not read that policy document that came out, so thank you for pointing it out. But we've also seen for alternate care sites the same kind of idea and documentation that's needed to show that basically if you're hiring X number of people to fill a duty based on what the public health department said and your public health official directed, what your state data is showing, that maybe there are more healthcare officials in this particular area for an alternate care site than are being fully utilized. And so now we're getting to the point of trying to understand how long do they need to be there, and based on the fluxes and changing numbers of people accessing or needing and requesting that kind of healthcare advice and any kind of testing and so forth that could be offered at that facility. So it's a similar concept there. If it was 30 doctors or 30 nurses and it's really only needed to be 10, how do we document why they put that many people in one place?
Very good.
And I would just add, there was a FEMA policy that came out on April 12th that did highlight purchase and distribution of food that would be eligible under public assistance. So I would just encourage folks that are asking about the eligibility of delivering meals, particularly within the non-congregate housing options that FEMA's outlined, to take a look at that policy memo, because it does outline what FEMA would be considered as eligible or not. And I think to what Wendy was saying, in terms of, if you do need to rent a block of rooms and you had a portion of the expected residents stay in there, I think it does, when you are submitting that back to FEMA for documentation, you just always want to consider, what is the story your documentation is telling. If you just show you rented 100 rooms, but only 30 people stayed there, and that's it, FEMA will likely and probably appropriately question, well, why did you rent all 100? But if you do include that documentation that Wendy was saying of the projections at that time, and really build the story of why you rented the 100, even though afterwards only a certain number actually did utilize those rooms, that goes a long way with telling FEMA through documentation why you incurred the costs that you did, why it was reasonable, and more importantly, why they should pay for it.
Very good. Question is, what backup documentation will be required under the CARES Act? Will it be similar to or different from FEMA's expectations for PA? So I'm assuming they're talking about CDBG, Health and Human Services, Department of Justice, Federal Transit, all the federal money. They're all federal. I think it's going to be similar. Perhaps not quite as detailed, but similar. Margaret?
Mike, that goes back to an earlier point that was made about all these various federal funding sources and the purpose of them, but to look at the individual guidance coming out. It's not a one size fits all, although we can make some, some good judgment calls based on what we know about FEMA and documenting, but the specifics will need to be reviewed by each of those funding sources and what's in the regulation or the law with it. And that's part of the reason why a whole, a spreadsheet, a tracker of all these various funding opportunities that are out there, and listing some of the nuances about their about exactly this, and reporting and documenting why that's important to get an understanding, because it's a strategic, it would be more strategic to see it in a big picture. And one place that I had actually looked for a document, and I suspect we'll end up seeing it, it may take a little bit longer, but the Congressional Research Service, they often do really good reports on, based on members of Congress, their need for information. So I can't help but think that's going to be forthcoming. I don't have a specific, although we could all make calls to friends on Capitol Hill to see if they can help us generate that kind of a document for everybody. But they do really good analysis of funding of different programs and whatever the need may be based on a congressional office.
And I don't want to throw, we got about 5 minutes left. I don't want to throw a monkey wrench in the works here, but I'd like to suggest that offline the panelists talk about the possibility of IAEM, that we might somehow collaborate on a chart of funding streams for CARES Act and priorities. Lots of people will be coming out with it and or trying to come out with it, and maybe we can each lighten our own respective loads through a collaborative effort to pull that together, because I think it's so important. See if we can get, okay, one more quick question, and then we'll be into wrap up. Is the purchase of ENS, I'm not sure what that acronym is, security thermal camera for facilities to check temperatures, covered under FEMA protective measure guideline? So I guess this is a way to detect people who've got a fever coming into a facility. And I don't know how much it costs. I don't know how many of them you need. Any thoughts, panelists?
I think it's going to depend on the type of facility. I think if you have I'm here in Mississippi, we're starting to reopen things. The courts, our courts opened last week. My husband works in the courts, and they're testing the temperature of every single person that walks in. That kind of situation, I do tend to think would trigger an eligible cost if claimed by the the locale or the state that runs that court, because it's a public facility, it's an essential use, an essential service, the justice system. I don't think FEMA would argue that that's inessential. And I think that the temperature checks are in furtherance of, limiting the spread. I say all that to say what I think the policy should be. I have not seen specific guidance on that type of tool. So,
Mike, I think this falls into the category of, like Wendy's saying, we don't necessarily know, and this has to be part of the national discussion of, what is this doing to everyone and their budgets and the economy in terms of how much money can FEMA through the disaster relief fund actually fund. And so, like Wendy's comment about what a critical and important part of our society the courts are, and then we'll get to airports and other transportation modes and a number of essential government services that are out there. And I just think we do need guidance from FEMA on this, and I'm sure they're thinking through all these things as well, and struggling to put together answers for everybody, because there's so many big questions and big policy questions out there.
Okay, very good. And we're within a couple minutes here of the hour. Miss Carolyn, do you wish to have a closing comment?
I don't really have a closing comment other than my thanks to the panelists again, and also to our participants. Do any of our panelists have about a 30-second comment that they'd like to make? That's about how much time we have.
Well, I'm going to grab the time here, take one more question, which I think is really apropos. It says, in a rush to meet the needs of health and safety, we bought many things before we checked the debarment status of vendors. Now that things have calmed down, we have backtracked and did get the document. Will this cost still be eligible? And I suspect it will be, because they weren't debarred or suspended. And I don't see in the 2 CFR that you should do it before, but as long as they're not debarred or suspended, I think you're probably okay. Any quick thoughts, Margaret, Wendy, or Branch?
No, I think in any circumstance like this where there are emergency circumstances or exigent circumstances, you may not have followed your own rules and regulations exactly, or what FEMA requires. I think the best you can do is write a memo to file, sort of explaining the conditions, what led you down this road, because I think that is something that FEMA may ask later on as they're reviewing their documentation, that, hey, this check happened after you've already paid the vendor or received the supplies or goods that you ordered. So, I think if you're ever in a situation like this or a similar one, memo to file explaining the situations and the life safety pressures that you were under, I think goes a long way. It may not go all the way, but it will help.
Very good. And with that,
that wraps up our time. Sorry, Mike, for cutting you off.
no, that's fine.
Thank you all for all of your participation, for your contributions. And we do have upcoming webinars on the same topic, so check your schedules, and we look forward to hearing from all of you again. Thank you all so much. Stay safe.